Welcome to Business Infrastructure, the podcast about curing back office blues of fast-growing businesses. If you're a business owner or operator looking for practical tips and solutions to scaling your business in a sustainable manner, you're in the right place. Now here's your hostess, 𝗕𝗂𝘂𝘀𝗶𝘲𝘀𝘀𝗜.
Hello and welcome to the Business Infrastructure Curing Back Office Blues show. I'm your hostess, 𝗕𝗂𝘂𝘀𝘀𝗀𝗜, and I'm joined today by my friend and mentor, Dilsa Bailey. Dilsa is the owner and senior consultant for an organization called the Right Credentials Network. Her goal is to help healthcare organizations such as hospitals, managed care organizations, medical schools, and large group practices build, repair, and analyze their credentialing, onboarding, and provider enrollment programs. The Right Credentials Network helps these organizations prepare for accreditation, arrange delegation, and train their staff. Building credentialing foundations that are sustainable, Dilsa implements the 𝗕𝗂𝘀 methodology as she helps her clients journey to success, thanks to the book Behind the Facade. I'm particularly excited about this interview because Dilsa, again, is one of my mentors, and I've waited for quite some time to do this interview with her, and I'm excited because I learned so much from Dilsa every conversation that we have, and I know that today will be no different because Dilsa is actually going to share with us how she helps promote patient safety by vetting doctors, something that we can all benefit from. So Dilsa, without any further ado, welcome to the show.
Thank you.
How are you today?
I'm fine. I'm sitting here grinning, listening to you. You sound so great, and I'm happy to be a part of your podcast today.
Yes. I'm sorry. Go ahead, Dilsa.
No, I was going to say, because when I read your book, I was just so excited that you sort of validated what I do and how I do it, and but you expressed it so well, and you do so much more. I learned so much from your book. I still pick it up.
Thank you. Thank you for that plug. And I didn't even have to pay Dilsa. For those of you who are listening, she's saying these words out of the goodness and kindness of her heart. So thank you, Dilsa. I really appreciate that. So let's get right into it. Can you first give us a little more detail about what you do at your company, the Right Credentials Network?
Well, like you mentioned, I vet doctors, or I help organizations set up the processes to properly vet doctors. That is, to make sure that they're qualified and that they're competent and that they are not criminals or sex offenders. And try to make sure that when a patient goes to an organization, that they can trust that that organization has made sure that that provider has the proper training and has gone through the proper, quality reviews to make sure that they are experienced enough to treat that patient. The patient shouldn't have to worry about whether that physician is competent or not if they trust that organization. And most organizations, like hospitals, are accredited. Hospitals are accredited by Joint Commission. There's another one that's called DMV and HBAP. I think that one's still around. But they have to go through an accreditation process to show that they actually credential, is what the term usually is, credential their providers. On the managed care side, they're accredited with the NCQA, and I'd probably mess it up if I tried to tell you what NCQA stands for, National Commission of Quality Assurance or something like that, or Council. But at any rate, they go through NCQA or URAC, which is the Utilization Review Accreditation, to make sure that they meet the criteria, that they're properly vetting or credentialing these providers to make sure these providers are sound and that they are competent and that they have this, not just the skill set, but the mentality to treat patients adequately. So what I do for a lot of healthcare organizations like the ones that you mentioned, hospitals or managed care, right now I'm working with a staffing agency, make sure that there are sound processes in place, just like in Behind the Facade. I have to make sure that they have some sort of structure. So I start out by assessing their policies and procedures to see what they're supposed to be doing and see if they are following what they've put into place, because that's the most important thing. When an accrediting agency comes in, they're going to look at the policies and procedures, but they're also going to look for evidence. And that's really the basis for most companies. And I've learned that the hard way. I started out just consulting gigs, going from one gig to the next gig to the next. And then I decided to put this into a business format. So the first thing I started doing was to establish policies and procedures for myself and for my contractors, because I've started hiring more and more contractors, and I need them to have some sort of guideline if I'm not there to discuss or to tell them what to do. And that's what the policies and procedures, that's the structure piece.
Okay.
The second piece that I help them with is, and I believe you call it records management in your book, which is fine because that's, a good term across the board. But for me, in the credentialing side, for what I do, I call it provider data management. You have to have a means to track all of your provider data and to follow it up and to be able to measure it. So there has to be some sort of performance metrics embedded in your provider data management, as well as tracking all of the provider data. For instance, the basic data would be for a managed care company. The basics is, where their office is located, whether they're accepting new patients, what are their hours, they accept handicap, all that kind of stuff, in addition to their credentialing information, such as licensing, DEA, NPI. So it could be a very long spreadsheet of all the information that they would need. But that information is now mandated or regulated through CMS. These organizations can now get fined if they're not keeping the information that they're publishing to the patients, if that's not up to date. So if their directory, you go to a directory and there's somebody on the directory that's no longer there, they could get fined. So there are a lot of different aspects, a lot of moving parts to what I help people get a handle on, get some control. So they get the control at first through the structure, second through the provider data management. The third piece that I help them with is assess the staff. In order to follow through on the policies and procedures and to be able to utilize the provider data management systems, which is usually software, some organizations are still in the spreadsheets, some of them still have hard copy files, so we try to work on that to move them toward a more information technology driven sort of, more up to date, I guess just to say.
Sure.
Yeah. But you have to have the right people in order to have them utilize those systems and know where to look for guidance in the policies and procedures. So you have to look for a certain mindset, because there are certain people that get stuck in the past and they don't want to change. So you have to look at the people's ability to change, their ability to grow, and just then start training them. And that's my fourth. That's the fourth thing that I do, is make sure that I train everybody properly, train them on the policies and procedures, not just on the policies and procedures, but the whole profession, because the profession that I'm in is called medical services profession. And it touches base with, it's interrelated with a lot of different functions around vetting providers. One function is credentialing. Credentialing is the same pretty much for all organizations. Some organizations may have more stringent criteria than the others. Hospitals have more stringent criteria than managed care. Managed care may have more stringent, maybe more stringent than a nursing home or skilled nursing facility. So everybody has a different level, but credentialing is investigating the physicians, verifying all of their credentials are accurate, looking at the provider, making sure he is who he is and that he hasn't had any issues, major malpractice cases, any quality of care issues anywhere else. Then the next piece is provider enrollment, where they get enrolled. They have to apply to the managed care organizations like the Blues or Aetna or United. All of those organizations that you get insured by, they have to credential those providers before they can see you, and that's called the provider enrollment piece. So it's looked at as credentialing, but in a slightly different way than hospital. I'm sorry, go ahead.
I have a really quick question, and I hate to cut you off there, but as I'm listening to you, I'm thinking, wow, this is a lot of work that's involved, yes. and it would make sense, right, because we're talking about people's lives here. But I'm wondering, do you start off doing some type of a diagnostic or assessment to really get a handle on all of those different areas that you mentioned? You mentioned structure, data management, assessing employees, and ultimately training them. Does every organization that you go into, I would imagine they have different starting points? Is that true? Or, how do you start off with an assessment, I guess is the question that I'm really trying to ask.
Oh, yes.
Okay.
I guess I skipped that part. I do. That's exactly.
Okay.
That's what I do. I go in and I look at what they're doing. I look at their policies and procedures. I look at their databases, or not just their databases. How are they functioning on a day-to-day basis? I usually sit with the employees to find out, okay, what's your average day like? And what happens if this happens? So I find out, and that's the kind of thing I started looking at first. Then I interview the department heads, everybody that's related to that particular function. For instance, risk management, quality assurance, or quality improvement, whatever, or performance measure, whatever the title is for that organization that has to do with quality, performance monitoring, risk, compliance, sometimes HR, dependent on how much they're interrelated, whoever is cross-functioning with that, recruiting, onboarding. So I'll talk with some major players, or I'll talk with the directors or the VPs and find out what their take is on how that particular department is functioning, or if it's not functioning, and what their obstacles are, what their challenges are with dealing with those organization or with that particular organization. And then also I want to know what are the good things, so we can try to work around the good things and build upon that.
Now, Dilsa, as a patient, how do we know whether or not a healthcare provider has been credentialed? Is there a way we could find that out? Oh, no, that's not.
No, well, actually, you do. You do. If they show up on their on the hospital's directory, or they show up on the managed care directory, they've been credentialed. They will not show up in any directory. They won't be published to the public unless they are credentialed. Now, at a hospital, they may have different levels of credentialing. There's several different statuses that hospitals grant, and they are usually two types of, they may have several different statuses with several different titles like active or courtesy or consulting. But the difference is whether they have admitting arrangements or they have admitting privileges. So if your doctor is referring you to a hospital, they may have admitting privileges at the hospital, or they may have admitting arrangements with someone at that hospital. Normally, not every family practice or general practice or internal medicine doc, your primary care, they don't have to have credentialing privileges at a hospital, but they will, have some sort of mechanism to send you to that hospital so they can interact with a provider who does have privileges at that particular hospital, so they can get your medical records or know what's going on with you when they send you to the hospital. But not everybody has to have privileges, but most of the people that you'll see, if your insurance company lets you see them, unless it's an indemnity plan, where they can charge you just because they went there, charge the insurance company. But if it's sort of like a point of service or an HMO or a high definition plan or a PPO, all of those, they're credentialed.
Now, Dilsa, do organizations reach out to you proactively? Is it that they know that they are up for some other type of audit and they reach out to you to make sure that they will pass that audit? Or are there some instances where an organization or a healthcare provider may have lost their credentialing status and they're reaching out to you to regain that? At what point do organizations, I guess, reach out to you is what I'm really trying to ask.
Organizations, I've had organizations that are startups that haven't had a credentialing process, that I've had to create a credentialing process for them.
Okay.
I've also worked with organizations who are interested in becoming certified or accredited. Usually they're, I've had managed care organizations that needed accreditation, full accreditation, but I would focus on the credentialing portion. And then I've also helped organizations become CVO certified through NCQA, which is the accrediting agency, and now that's an accreditation going forward, I think, this year. So I've helped them prepare for accreditation. I also have helped them repair some bad situations where the staff didn't have leadership or they didn't have any processes in place and things were just not meeting the requirements. It was sort of kind of messy. I've had to go in where individuals have, they've not been properly trained or they hired the wrong type of people to run that, someone without any experience and they don't know what they're doing. So I've helped train those individuals whenever possible and help move the program forward. And I've helped repair programs where they didn't realize they needed to be credentialing. And so I've helped them put something into place and help them get prepared for CMS surveys. So it's been interesting. It's been very interesting.
Well, I'm sorry, go ahead.
No, I was going to say, a lot of my clients are referral based. I get a lot of referrals.
What's really cool about listening to the work that you do is we can definitely hear business infrastructure at play. And for those of you who may be listening to this show for the first time, business infrastructure is literally just a system for how you link your people, processes, and your tools and technologies together to ensure that growth happens in a profitable and sustainable way. So Dilsa is doing a really good job of explaining all of the different types of people that she works with, the processes that she uses to ensure that she helps these healthcare organizations maintain their accreditation, and as well as the different technologies and other tools that you leverage to make sure that they actually pass their audits. Now, I think you were kind of starting to go into some important lessons that you've learned, or at least you were hinting at that. And so that's actually my next question for you. I'm sure, now just again, for those of you listening, I know, Dilsa, when we had lunch not too long ago, we were talking and you said, it's amazing how some people just trust doctors and trust that they are who they say that they are. And so that was a lesson that I learned from you when we had that particular conversation. But I'm wondering, are there other lessons that you've learned as a result of the work that you've been doing for the past several years?
I guess the first lesson I learned when I got into this business, because I've been doing this for about 30 years now, which is scary. But I think about it, I'm like, I've been doing this for 30 years. The first thing I learned was that doctors are human. And they have the same rates of failure, the same rates of criminality, the same rates of substance abuse as everybody else. So, but on the other hand, most of the doctors, I'd say 90% of them are very, they're very good at what they do. They're very dedicated to what they do. And I really admire them because it takes a lot to become a doctor, and especially when you're specializing. So I don't take away anything from them. I just know that there are some out there that makes it bad for the other ones. I don't know if you've ever heard of have you ever heard of the podcast Dr. Death?
No, I remember you mentioning that to me the last time we talked, but please tell us more about that.
Well, Dr. Death was a neurosurgeon down in Texas. He went through, I guess, one of the top medical schools in Tennessee or something. He got through it in a weird way. I mean, he only performed about 100 surgeries in neurosurgery training. And normally they, was one of the doctors they interviewed said they normally did thousands, before they graduated. And this guy only did about 100. And so first of all, he wasn't a good surgeon, but he had a very big ego. This man ended up he was at Baylor Plano, I think it was, that he started injuring people. So he injured all total about 34 people. And I know about at least 2 of them died as a result of his surgery, his botched surgery. Now, the problem with him, not only that he was, and he even bragged about the fact that he was able to just kill people. So at any rate, the big issue with him was not just the fact that he was a dangerous person, a dangerous human being that did not have anybody else's safety or well-being at heart, is that he was able to get through a lot of different organizations untouched. Even though people were complaining about him, there was just a lot of failure in the systems of watching him. Even the medical board down in Texas, they didn't act in a timely enough manner to save people from this guy. So it was a really big study on the failure of the whole process of the performance monitoring piece, of people speaking up, because people would think, he was a neurosurgeon, so they thought of him as, like God. He was, big dude, so people were afraid to speak up. It didn't until a couple other doctors had enough of seeing injured patients that they stepped in and started trying to get this guy pulled down. That's when it started happening. So when the doctors took the doctors took initiative to stop this guy, that's when he finally came down. But before that, he just kept going. And because neurosurgeons generate a lot of money, the hospitals sort of turned their back. So it was a very interesting study. If you ever get a chance to listen to it, if you don't want to be frightened to go to the doctor, but like I was telling somebody last night, they were telling me about an elective surgery, and I was like, I don't do elective surgery.
Wow.
I don't do any elective surgery.
And I almost feel like I need to do a quick PSA here that is an isolated incident, Dr. Death, because as Dilsa has already said, a very large percentage of the doctors that she has personally worked with really are very good at what they do, and they are dedicated, and they will report things when they see that they, maybe a fellow doctor is not doing things according to standard operating procedure or in the best interest of a patient. Because my sister is a doctor, and I don't need her coming from my head either. So tell her she's one of the good ones.
Right, she's one of the good ones.
Just wanted to give that quick PSA there. Look, Oh, go ahead, Dilsa.
No, I was just going to say, I appreciate doctors. I love doctors. They are great at what they do, the majority of them. There's always that very small percentage that you have to be aware of, and that's why credentialing is a very important function.
Sure.
And yeah.
Yeah. Well, when we come, I want to take a quick commercial break, and when we come back, I want to know if there is some specific advice that you can share with those who may be listening that either work in the healthcare industry and they know that their organization is up for accreditation, or if there is a provider, him or herself, that is looking for someone for some help. I'd like for you to come back and share some advice with us. But let's take this break really quickly.
Okay.
Do you currently have more business than you can handle? Do you need to hire more people but don't have processes documented to train them? Behind the Facade, How to Structure Company Operations for Sustainable Success is a book that explains, step by step, how to create business infrastructure in your company so that you can hire the right people to do the right things in the right working conditions. It's the world's first book ever written about business infrastructure exclusively for small businesses. Visit behindthefacadebook.com to get your copy today. That's behindthefacadebook.com. And we are back with Dilsa Bailey. And before that quick break, Dilsa, you were just really explaining to us how you've been able to leverage your 30 years of credentialing expertise to help healthcare providers vet doctors to ultimately ensure the safety of their patients. What advice would you offer to, again, those who may be listening, who work in the healthcare industry and they know that their organization may be up for accreditation, or for those who may actually be healthcare providers and may be seeking some advice to prepare for their next audit?
Wow. Give me a call. Yeah, actually, you really do need to look at, I guess, first of all, you need to find out if you have any performance issues or any productivity issues in your organization that's prohibiting you from meeting the criteria for accreditation, or just being able to bring your providers on board in a timely manner and making sure that they are actually credentialed properly before they touch a patient. My company, the Right Credentials Network, of course, I consult and I help people assess and structure organizations. But if you're not in the market to do that, make sure that the people that are working for you are properly trained. And that's, I cannot emphasize that more than anything. Even if I come in, I want you to make sure that those people are trained. Sometimes individuals, and that's what happened to me 30 years ago, come in, do not have any idea of what the medical services profession is, have no idea what credentialing is. I remember when I first came on board, I was working for the vice president of medical affairs at a hospital that had just merged with another hospital that had no staff. And he brought me a manila envelope with 2 pieces of paper in it and told me to credential this doctor. I had no idea what he was talking about. Eventually, I learned, I taught myself, and I had a physician that came in to speak to the organization at one point that was involved with the National Association of Medical Staff Services. He had been speaking at their conferences, and he told me to join them. So I joined the National Association of Medical Staff Services, and I started learning. And then I started networking and learning I was in Pennsylvania at the time. They had 2 state organizations. They had the Southeastern Pennsylvania Association of Medical Staff Services, and then they had the Pennsylvania Association of Medical Staff Services. I joined all of those people. I joined all of those organizations. I networked with everybody in town. I was in Philadelphia, so Philadelphia was hospital rich at the time. There was a lot of hospitals. So I started networking, going out to dinner, talking on the phone. Whatever problem we had, we shared, we helped each other out. So that's the first thing. You need to make sure that the people who are doing that position, that's in those positions, are very well versed in all of the accrediting, all of the regulatory requirements, because everything changes so frequently. Even the criteria. When I started 30 years ago, there was probably 5 or 6 items. Now there's probably 17 or 18 items that you have to look at in order to complete a file. And that doesn't include all the data that the providers have to put in the application. So it's an ever-changing environment, especially with all the regulatory changes. I just sat through a course on quality about how physicians are going. The payment structure is changing from fee-for-service to a wellness structure. There, if you help keep a patient, and I can't remember what. I'm sorry for a moment there. I'm losing that, but they're going to get paid for keeping you well instead of getting paid for treating you for a symptom. So that's something value. I cannot remember the whole thing right now, but at any rate, value-based. It's going to be value-based payment against fee-for-service payment. So those are things that are going to affect the payment structure, but you have to have the providers credentialed or enrolled properly in time to make sure that you're not having to worry about retro payments and how all of that is going to change. So, there's a lot of things to consider. It's a lot of moving pieces. So the people that are doing these jobs really need to know why they're doing it. They need to know the criteria, why the criteria, who's mandating the criteria, and why it's so important.
Awesome. Well, in that same vein, are there some resources, Dilsa, that you can share with us for those who may be seeking assistance in accreditation for their healthcare organization?
Well, first place to always go is the accrediting agency to see what their requirements are. Secondly, get involved with there's so many different agencies out there that offer training, even AMA, so there are a lot of different places, networking with your local state associations, whether it's for the physicians or whether it's for the medical services professionals. For the medical services professionals, NAMS have state chapters in all the states. Some of them have multiple chapters if they're in large states like Pennsylvania. That's where they can get trained at to find out more. And, pretty much networking, I have to say, is very, very valuable. Get to know people that's in your profession or in your healthcare lane. Whether you're managed care, talk to people that's in your same position, and you'll learn a lot more, and you'll learn where to go to get information.
Now, Dilsa, I know you've also written a book called A Comprehensive Guide to Finding the Right Doctor. Can you talk about that a little bit more, too?
Sure. I used to get phone calls when my friends and my family found out that I was working at a specific hospital or that I was in this business to ask me about a doctor. Well, I can't tell them about the doctor because I don't have the authorization to release any information about the doctor. So I would tell them where to go look for themselves, because I wasn't going to, breach confidentiality by letting them know if the doctor had any malpractice cases or any issues or anything like that. That's not what I do. So I wrote this book with some very basic things for lay people to find out about their physicians. And it's very basic, but it's, helpful. The book is a good reminder if you don't remember what to do. And it also has like a medical records thing for you to keep, sheet for you to keep in the back of it. But one of the things that you always want to do is check their license. The licensing board is a very informative place to go. because the licensing board not only tells you whether the license is active or not, it will also list whether there's been any actions taken against the providers. Like here in Georgia, you can pull up a PDF immediately. And in most states, you can pull up a PDF immediately if there's a public board order. Now, that's only if it's a public board order. If they have a private board order, you probably won't know about it until something happens. Say, for instance, they are not compliant with the board order, then it'll get reported. If they are compliant, then you'll never know about it. And usually the private board orders, or the ones that I've had experience dealing with, are usually impairment issues. They're in some sort of impairment program to get clean. So they've been reported to the licensing board, and they've gotten into a program, and as long as they're compliant with that program and they stay clean, then the public won't know about it. But if they're not compliant, then the board order will become public. So you can always look at the licensing board. A lot of licensing boards, like Georgia, I like Georgia's licensing board, they have a profile. So the profile will tell you that the doctors are supposed to self-report any issues on the profile. And they will get fined if they don't report accurately. So you can look at their profiles. You can look to see if they've had any board orders, and you can see if their license has any issues. I found out a few years after, thank God my kids were grown, that my kid's pediatrician had her license revoked for fraud and abuse.
Oh, wow.
Yeah. So, there are certain things that you can find out about your doctor just by verifying their license. So that's a simple thing. If you're a Medicare patient and you want to make sure that they're accepting Medicare or Medicaid, you can look at, I've listed in the book, the Office of Inspector General. You can look at the regional carrier to see if they've opted out of accepting Medicare. And you can look at the System Award Management. All of that is public information. It's out there on the system, out there in the internet. And of course, you can always Google, and Google is not always your best friend.
Right, and that's why. But I must tell you, I always tell my guests before the show starts, please don't say, well, just Google it, because there's a lot of misinformation online. And so
there's a lot of.
Yes, and as an expert, you are able to tell us how to sift through all of that information, because
right.
you've vetted it. So, yeah.
Yes, Google is definitely not your best, not always your best bet. Google can raise some red flags for you, though, but Google can also give you the wrong impression. For instance, of going back to Dr. Death, when they Googled him, he was a star, so he was fantastic, and he had all these great commercials and everything. So everybody thought he was a fantastic neurosurgeon. But on Google, for instance, I found out in one organization that one provider was the main suspect in the disappearance of his girlfriend, and that was still open. So those are things that were left for discussion, So Google can be a friend, and Google can be your enemy. So I wouldn't rely totally on Google. If you're looking for reviews on the physicians, there's health grades, there's actually CMS now gives scores to physicians. NCQA, you can get some physician scoring on there as well. And there's a few things that I've put in the book. It's been a long time since I've read my book. But there are a few things that you can do to vet the provider. And one of the things I want to tell you, too, if you ask a friend or a family member for a reference, also take into consideration that person's expectations, because sometimes your expectations are not the same. I've found that out a few times. So often, not often, but what I've done in the past and what I do recommend is, the doctors, they don't have time for you to interview them. So schedule a visit with them and interview them during the visit. So they get paid to get interviewed, but still, that's how you can determine, too, whether you want to trust that physician or not.
Good idea. Well, Dilsa, unfortunately, we've come to a close. I knew this would happen. This has been really great information, and it's really like a 360-degree approach to vetting. So you described to us how on the healthcare provider side, how the processes that they go through and the people and the technologies that are used to properly vet doctors. And then on the patient side, there are all of these resources that you've shared with us to be able to properly vet a doctor. So this was great. Thank you so much.
Oh, you're welcome. Thank you for having me.
Now, how can people get in touch with you?
Well, I have a website, which is out there as my business card. It's 𝗕𝗂𝘀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀𝗀 𝗕𝗓credentials.com.
Okay, awesome.
And yeah. So I'd love to hear from you.
Well, thank you, Dilsa, so much for being on the show. This was great information. As always, there's so much to learn from you, and I'm sure so much more. But thank you for taking the time to speak with me today. I really appreciate it.
Thank you.
And now I want to talk to you, the person listening to this right now. Do you need help vetting a doctor? Or if you are actually a healthcare provider or you work within the healthcare industry, is your organization preparing for its next accreditation? Here's a recap of how Dilsa successfully helps her clients vet their doctors. Number one, she talked about the importance of laying down the structure, the foundation, that business infrastructure. Specifically, she talked to us about the policies and the procedures that she helps these organizations get in place. She also talked about data management. She also talked about the importance of assessing your employees. And lastly, the training, which is so key because, as she said, this is an ever-changing environment, healthcare that is, and there are a lot of moving pieces. And she said something else that really stood out to me, because oftentimes when we think of policy and procedure and process and data management, we just think these are nice to have types of things. But when these accrediting agencies actually come and conduct these audits, they're not only looking to see that you have these things in place, they're looking for evidence that these things are actually working, not just the fact that they're in place. So I thought that was really key, that evidence piece. She also told us to watch out for Google, which I think we all know now, and just in general offering us a 360-degree approach at how to properly vet doctors, because at the end of the day, this is all about patient health and safety. If you want to learn more about Dilsa and the important work she's doing, definitely reach out to her on her website, which is 𝗕𝗓credentials.com. You can also email her at info@𝗕𝗓credentials.com. We will have links to all of the information that Dilsa shared with us in the show notes at businessinfrastructure.tv. While you're there, you'll also be able to subscribe to the show on your favorite platform, as well as download this episode for future reference. And while you're there, don't forget to let us know your feedback. Again, you can do all of this at businessinfrastructure.tv. Thank you so much for tuning in. And remember, stay focused, be encouraged. This entrepreneurial journey is a marathon and not a sprint. Until the next time.
Thank you for listening to Business Infrastructure, the podcast about curing back office blues with 𝗕𝗂𝘂𝘀𝗶𝗄𝗂. If you like what you've heard, do us a favor and subscribe, leave a rating and review, and more importantly, share with your colleagues and team members who could benefit from the information. Join us next week for another episode of Business Infrastructure with 𝗕𝗂𝘂𝘀𝗀𝗃𝗃.